Welcome to this video on the introduction of a low-fidelity simulation module for basic suturing skills for Phase 3 MBBS students. This module is designed to prepare you for the Objective Structured Clinical Examination, or OSCE, and uses a 10-point rubric for assessment. Step 1 is to establish the patient communication loop. The objective is to ensure autonomy and trust by explaining the procedure and obtaining explicit verbal consent before touching any instruments. This earns you 1 point. Remember, consent is a dialogue, not a monologue. Step 2 focuses on organizing the aseptic field. The goal is ergonomic readiness, preventing fumbling. Correctly identify and organize instruments like the needle holder, toothed forceps, surgical scissors, and suture pack. A well-organized tray earns 1 point. Group instruments by their phase of use. Step 3 is donning the sterile barrier for infection control. You must demonstrate proper hand hygiene and donning of sterile gloves, which is worth 1 point. Follow the steps: hand hygiene, glove 1 and glove 2, ensuring sterile touches sterile and skin touches skin. Step 4 is mastering instrument physics for mechanical advantage. Secure the needle on the holder at the junction of the proximal 1/3 and distal 2/3 to prevent rotation. Holding too close to the swage bends the needle, and too close to the tip prevents deep penetration. Step 5 is atraumatic tissue manipulation, aiming for viability preservation. Use forceps to gently stabilize wound edges without crushing or causing trauma, avoiding ischemic necrosis. Treat the epidermis like wet tissue paper. Lift, do not crush. This earns 1 point. Step 6 is the geometry of the perfect bite, aiming for optimal wound eversion. Enter the tissue at a 90-degree angle, ensuring equal depth on both sides. Fully pronate your wrist to achieve the 90-degree entry. Let the needle's curve do the work. Rotate your wrist, don't push down. Step 7 is securing the closure to ensure structural integrity. Execute a secure square or reef knot using the instrument tie technique. This locks the tissue without slipping or strangulating the blood supply. Cross your hands after each throw to lay the knot flat. A square knot locks. Step 8 focuses on spatial symmetry and tension for even force distribution. Place sutures at equal distances from each other and from the wound edges. This prevents high-tension areas that cause track marks or dehiscence. Use the rule of halves for guaranteed equal spacing. Step 9 covers tool handling for tail length. The objective is a safe tail length, long enough to prevent untying, but short enough to avoid tangling. Cut suture tails to approximately 5 millimeters using the tips of the scissors. Slide the open scissors to the knot, angle them at 45 degrees, and snip cleanly. Step 10 is Environmental Safety and Sharps Protocol for Occupational Hazard Prevention. Handle sharps safely by not recapping and disposing of waste in correct bins. A manually recapped needle is an unnecessary liability. Successfully following all 10 steps earns you a total score of 10 out of 10.